Welcome to the Essential Hub once again. As part of our nursing practice, we all know that day in, day out, we face patients having difficulty in breathing problems and even patients with heart problems. As a nurse, what kind of bed are you going to nurse this patient in for the patient to feel relieved? That is why there's a bed called cardiac bed. And so this episode is going to outline how a nurse will lay a good cardiac bed so that we can nurse patients with respiratory and cardiovascular problems. Sit back, relax, and enjoy the video. Thank you. Making of cardiac bed begins with the nurse collecting and arranging items on the trolley, as you can see being displayed on the screen. And so the first step in making a cardiac bed requires the nurse to collect, arrange items on trolley and send to the bedside. So as being displayed, the nurse has collected his various sheets that is going to be used to lay the bed and is arranging the pillows also at the down shelf, ready to move to the bedside. And so after collecting the items and arranging them on your trolley, you then proceed to move your items to the bedside. And before doing that, the nurse inspects the bed to ensure that the bed is in good shape with all the wheels of the bed locked, ensuring that there are no defects of the bed and that the bed can be used to lay the bed safely and successively. After ensuring that the bed is in good shape, the nurse now proceeds to move the items to the bedside as being displayed on the screen. At the bedside, the nurse arranged 2 chairs at the foot end of the bed. These 2 chairs are responsible or functions as a medium where the nurse will now arrange the collected sheets or items in order of use on these 2 chairs. In the absence of these 2 chairs, the nurse can equally use what we call a hat table in the absence of these 2 chairs. And so you arrange your items in order of use on the chairs or hat table. Some people can arrange the items in order of use one after the other. Others will also arrange it in order of use on a trolley and then turn it upside down when they get to the chair. It is advisable to arrange it in order of use so that when you get to the chair at the bedside, you just turn it upside down to facilitate easiness. With an assistant, the nurse begins to lay the bed. The nurse starts by placing the bottom sheet evenly on the bed, placing the bottom sheet evenly on the bed. As you can see, moving in one direction with the assistant to spread the sheets evenly across the bed and begins to tuck the sheets under the mattress using enveloped corners. You tuck the sheet under the mattress using envelope corners. As we have seen in our previous episodes, how we tuck in sheets under the mattress using envelope corners is the same technique that we use when we are laying a cardiac bed. When you are done with the top side of the bed, you move to the bottom side and pull the sheet so tightly to make the bed free of cramps and creases. You pull the sheet so tight that there are no creases, and again you tuck the sheet under the mattress at the bottom side, also using what? The envelope corners. With the help of the back of the palms, the nurse sweeps the sheet to straighten it to be free of cramps and creases. The next is to place your drawer marking touch across the bed. Your drawer marking touch across the bed. This drawer marking touch is a rubber-proof material that prevents liquid from soiling the bottom sheets. Viewers, this is Essential Hub channel, If today happens to be the first time you are joining us, don't forget to hit the subscription button so that as and when we release a new video, you'll be notified to follow us accordingly. After the rubber marking torch, which is a draw sheet, the nurse places a covered air ring on top of the draw marking torch before placing the draw sheet on the covered air ring. This air ring serves to relieve pressure on the sacral or the gluteal region of the patient, thus preventing pressure sores or decubitus ulcers, which are also called the pressure sores. The nurse ensures that the rubber material, the draw marking torch, is not showing, and so tucks it under the draw sheet perfectly. This is because in nursing, we do not want our patient to be lying barely on rubber material, because this can trigger or bring pressure sores to the patient. Right after the draw sheet, the nurse raises the head side of the bed to an angle of 45 degrees, which is also known as the semi-Fowler's position. So with the use of the wheels of the bed at the foot end, the nurse raises the bed, the top end of the bed, using the wheels at an angle of 45 degrees. With the help of an assistant, the nurse will put on the pillowcase on each of the pillow and arrange the pillow at the top end of the bed in an armchair-like fashion. Again, this varies across schools, but the idea is to make sure that the patient is comfortable with the pillows. Some use 3 pillows to arrange it in an armchair function, which is not also entirely wrong, but at the end of the day, the pillows are arranged in an armchair fashion to help cushion the patient against breathing problem. And so per this protocol, you can see the arrangement being done horizontal, one dropping at the side, the other also dropping at the side, another crosses at the middle portion, another at the top side. This is the armchair we are talking about. So the patient should rest in that to provide the patient with comfort. After arranging the pillows in an armchair position, you place top sheet on bed with the wrong side uppermost. You place the top sheet on the bed with the wrong side uppermost and fold sheets over at the bottom. Place the top sheet on the bed with the wrong side uppermost and fold sheets over at the bottom. You must also ensure your footrest is in position. The footrest, as you can see with this bed, there's already a footrest or a footboard, and so we don't need to put that again over there. In the absence of the footboard, you can use a sandbag to help replace that footrest. Most institutions like to use a counterpane in addition to the top sheet, but as you can see being displayed, a counterpane can be used if necessary, but in this video we are not using a counterpane. So you move your 2 chairs and bring your prepared hat table, which contains a pillow, a bell, a sputum mug, a pen, and a pamphlet that the patient can write on in terms of communication, because you don't want to stress this patient to talk too much, because you want the patient to rest. And so this is a descriptive display of a cardiac bed that you can see. So you clear your chair and hat table or trolley, you wash this and dry your hands using an alcohol rub or you can use or wash your hand according to the World Health Organization protocol under running water. This is a classic cardiac bed that you can nurse our patient having respiratory and cardiovascular problems. Hi viewers, this comes to the end of the cardiac bed procedure. I hope you enjoyed the video very well. See you again on another episode of Licensure Hub. Thank you very much. And don't forget, if today happen to be the first time you are joining us, click on the subscription button and the bell icon so that as and when we release any new video, you'll be notified. Thank you very much.